So welcome everybody, this is another video. Today I'm looking at the relationship between back pain and our emotions. So the first part of this video I will show just some quick assessment that I'm doing here. I'm checking with no oil, I'm checking the temperature, I'm checking the kind of lines and different various textures that I'm finding on the feet. I'm assessing the alignment and where there are misalignments. So again, I'm looking at heat differences from one foot to another, which means, differences in one side of the body to the other. And here I'm really looking at alignment, seeing how the hips are and where one foot falls compared to the other one. So here I'm assessing how the hips lie right now, how the right foot lies compared to the left foot. And again, the left foot is falling outwards, and that will obviously have an effect on the left side of the body because it's indicating that there is a hip misalignment. And of course, when one of your hips is feeling misaligned, it will affect your shoulders, it can affect your feet, goes all the way up and down. So here I'm just checking along the spine, feeling the differences or the similarities between the two sides. I'm checking the flexibility of the toes, which will relate to the neck and head spaces, and of course sinuses. And I'm looking at the shoulders. I should point out again, please don't watch this while you're driving or operating machinery. It may be fine, but when we watch treatments, it can nicely make us feel relaxed, but you don't want that kind of situation happening when you're in control of a vehicle or some other form of machinery. So please be careful, and otherwise just enjoy the video. So I'm just doing some relaxation techniques here. So it can be a bit of a shock to realize how much our emotions affect our physical performance and our physical feelings. So every thought we have has an impact on our body. You just have to think about, when you see someone that's depressed, their shoulders are hunched over, they may have their head down, they may have their shoulders hunched over. Just think about how they walk, how you can tell that that person is not feeling great, as opposed to someone who's on, is feeling confident, on top form. Then you will see how they have their shoulders back. There's even the Superwoman pose that Amy Cuddy talks about on YouTube, which is quite a good watch. So this is basically what I'm looking at today. And the gentleman that's come to see me has a history of back pain. And I've always wanted to do this video because I think it's really important that we recognize that when we are going through stuff, it will affect our physical well-being. For instance, I remember the first time I read Healing Back Pain by Dr. Sarnos, and I thought, why is this not recommended reading for all therapists? It should be. Because when I was at university in the States, I remember I was rushing to an 8 a.m. class in 8 inches of snow. This was years ago, and I fell really badly and had to be lifted and helped back to my apartment because I lived in my professor's apartment. She was teaching in Tokyo, And I remember it was the fear of not being able to finish my master's and being stuck, incapacitated in this apartment for months that actually made the pain worse. And I began to fear the pain. But at the same time, I was on a deadline for my thesis and I had 3 part-time jobs to pay for it. So certainly this anxiety played a part in keeping me in a state of anxiety. It wasn't until I started incorporating meditation and gentle walks and self-hypnosis that I could fully recover. But I remember clearly to this day how it affected me, that not being able to move, or the aches and pains and worrying about what they meant. And how wonderful it is to be, and was, to be feel free of that pain. But there are times when you feel like you're just not going to be able to get back to feeling good. So what I'm doing here is I'm tracing the reflexes of the lower back and the reproductive area. And I'm just trying to assess what's going on, because there are dark patches there. And there's heat on one side and not the other. So I think once you've had a back, then the techniques that bring you relief really should be incorporated into regular practice. Just as once you find the tools to regulate your anxiety, you should incorporate them into a regular practice. You know, it may only take 3 minutes a day, but it certainly worked for me. So Dr. Sarno, healing back pain, he said, medicine must acknowledge the important role of emotions in health and illness. And that's so true. So let's think, for example, we often talk about shouldering responsibility, and that just getting through it is the only option. But in my work, in both reflexology and hypnotherapy, this rationale only works for so long before the body starts to give us undeniable signals that things are uncomfortable. And Dr. Sarno also said there's nothing like a physical pain to keep your mind off your emotional problems. So think about that again. There's nothing like a physical pain to keep your mind off your emotional problems. I believe Snoopy also said it. So here is a client who allowed me to film his treatment. It's filmed using my phone. And again, the intention here is to explore what we might look for in getting a full picture of the symptoms that he was experiencing. So doing a bit of detective work. So this client has a history of left shoulder pain, back issues leading to general discomfort or deep pain, and sometimes sleepless nights. He had a serious accident over 20 years ago as a cameraman, and one can see the effects of this injury, which literally left him black and blue, the accident. And so it translated into constant shoulder issues and lower back issues. And the pelvic girdle and sacrum often get tense, so the pain travels up and down from shoulder to knee to hip, as so often is the case. The emotional element here is that the job was very challenging. It was a difficult environment, leading to many colleagues experiencing emotional exhaustion and burnout and getting no support whatsoever. And this is something that's often highlighted in Dr. Sarno's book. He noted that it's perfectly acceptable to have a physical problem in our culture, but people tend to shy away from anything that has to do with the emotions. So if we're in a challenging environment and not getting support, then our sense of well-being diminishes, which can affect our motivation and productivity, of course. You know that feeling like you have the weight of the world on your shoulders. And notice how you're walking when you're feeling like that. When you feel like you've got the weight of the world on your shoulders, just think about how you walk. Think about where your head placement is. You can even see it, think about our dogs and cats when they're feeling low. They walk differently. They hunch up, their heads are down. If Oreo doesn't get her own way, she will hunch up and head down. She knows exactly what to do to get me to give her a cuddle. So, think again about those quotes. It's perfectly acceptable to have a physical problem in our culture, but people tend to shy away from anything that has to do with the emotions. What happens as well is that you can recover. You can have your back get better, or your shoulders get better, or your lower back get better. So we get a subsidence of the pain. It may be a headache, backache, shoulder issues, skin issues, toothache. But before long it reappears. And again, referring to that book by Dr. Sarnos, he says, patients often report pain in a new location as the old one gets better. It's as though the brain is unwilling to give us up this convenient strategy for diverting attention away from the realm of the emotions. So, you may have those recurrent tummy problems. IBS symptoms rear up and then go back down. Headaches, migraines, shoulders, skin flare-ups, all these kind of things. So we use the reflexology treatment to track and trace where the body may be misaligned, feel different in temperature, where colour is uneven or pale or dry, and where there is heightened sensitivity or it feels numb. And reflexologists will be looking for those as I'm going over the shoulder girdle here into the neck and back down to the shoulder right now, into the diaphragm. What I'm looking for is the areas that give my client relief and the areas that show up with different sensations. This client likes really heavy pressure, by the way. So I use a tie stick here. So I'll give you another personal example here of when I had surgery, and as a result my pelvis had become completely misaligned. And it was through very gentle reflexology and careful monitoring that I could re-establish balance and a new level of comfort. Nevertheless, I still had to process through self-hypnosis and meditation the traumatic effects of being in intensive care. And once I'd explored ways to accept and move on, I was able to feel more healthy than I ever felt before. And so as I go right into this client's right shoulder, check the flexibility. I love having this done myself. I love my shoulders being done. If you get resistance training, you like that. It's like having your shoulders deeply massaged. It's gorgeous. So this gentleman did change jobs. as his work environment was not going to improve. And immediately the pain started to cease. However, as soon as he was confronted with a stressful situation, the issues returned and were even more of an issue. So again, thinking about what Dr. Sarnos said, patients often report pain in a new location as the old one gets better. This client was experiencing lower back pain, and then it would go up to shoulder pain and often referred up into a headache. It would refer down one arm. So it really is a process of working out where the fall had impacted the body, and through gentle reflexology, working on that pattern, but also having a conversation about what simple tools may be used to not react to the stress in the same way, but give yourself tools to respond to the stress. And that's what I do in hypnotherapy. A lot of the hypnotherapy is self-hypnosis because it is so powerful. And again, as I always say, it's a collaboration between myself and the client, just as it's a collaboration between myself and the client in reflexology. This is really nice. The forearm massage down the spine can be really, really nice. Some clients love this because although I'm going in with a Thai stick, it's also very important to keep adding in those nice effleurage movements and gentle flexing of the reflexes. So again, if we combine some gentle physical acupressure like reflexology, like auricular reflexology, hand reflexology is amazing, with some therapeutic techniques to alleviate this stress, like self-hypnosis, we can start to see a positive future and literally let go of what is burdening us. There's another great book in my library by Dr. Steve. I'm just leaning over and reading it again. Healing Beyond Pills and Potions. I wanted to get the full title again. It was a really good book. And he always says he's a physician and he uses hypnosis in his work. He's done some incredible things to help people realise the relationship between their emotions and how they physically heal themselves. So he points out that mind matters, basically. Our mind, the way we respond, our map of the world, as they say in NLP, really matters. So our stress and psychological issues relating to work and family and childhood manifest as physical pain. And once that's properly and carefully explored in hypnotherapy, amongst other routes, the pain and illness can all but disappear. So while I'm working on the reflexes, I'm asking the client to point out areas of discomfort and areas of ease and comfort, so he can release and let go. And the phrase let go is very powerful, because what you can do is you can let go of thoughts that are ruminating You can let go of trying to fix something, going over and over something over and again that's gone, that's past, that you can't do anything about. You can let go of perfectionism, which makes a lot of teen students quite poorly, and adults. You can let go of people pleasing. You can let go of the feeling that you're not good enough. You can let go of trying to be super mum, or the perfect wife, or the perfect husband. And when you do let go in that mental space, I promise you, you'll notice a difference in your body. If you've been in that state of stress for quite a long time, then the difference in your body can be really surprising. So while I'm working on the reflexes, I am asking the client to point out areas of discomfort and ease. He particularly likes a lot of pressure, so I did use the tie stick, but I would not recommend using this unless it's a client that you've worked on before, or a client that has had experience of tie foot massage. I love it, but then I love heavy pressure. So we've got to treat each client as completely unique, of course, as they are, and so adhere to the principles of feedback from them. So you'll notice that I spend some time around the medial and lateral sides of the ankle, and that is because there are darker areas there, which suggests that not enough oxygen is getting to those muscles around the pelvis and lower back. And incidentally, Tony Porter has demonstrated some lovely techniques for working on these areas in his book. In this particular case, I might have a conversation with the client about what forms of exercise they do, if any. Furthermore, the calves on both sides of the body were tight reflexes and dry and flaky. So they were tight and under-resourced areas. So in that case, I would have a conversation with the client about how they relax, how they switch off, their work-life balance. How do they think that is going? There's a really good thing that you can find on the internet. I think it's always fascinating, and it's something you can do over and over again, especially when you get to those moments where things have gone a bit meh and you're feeling a bit low or unmotivated. There's the wheel of life, and your life is sort of broken down into 8 areas. It's like a pie chart, and you have to work out. There's things like family, adventures, work, relaxation. There's lots of different things that you can look at, and it's looking at the balance of these things. So personal development, career, finance, health, family, friends, social life. And when you look at the wheel of life, and you think about this in relation to someone getting backache, right? Finances becoming a worry, that can affect the back. family, not getting enough time with family, not getting enough time with friends, career taking too much of a priority. A really powerful one is personal development, of course, because if you're not being stimulated by your work, then it can lead to you feeling extremely unmotivated. And all those feelings of no motivation, it's like if you haven't got motivation, you get up out of bed reluctantly. You may not have the incentive to go and work out. You may lose enjoyment in a lot of things, so not take care of your nutrition. So these things all play a part. So again, I want to look at this chap's work-life balance and just ask them how they think it's going. What do they do for enjoyment? What do they do to switch off? Do they have any social time? Do they have any time just for them? Do they have any spiritual practices? Spiritual practices might be just going for a walk on the beach or taking the dog out. That's a spiritual practice. Just being at one with your dog and the trees. But when they start to wane and the more pressure is put on you, you may find that's where the ailments start to kick in. I mean, in Beyond Pills and Potions, the book I mentioned, there are some absolutely fascinating cases of how this physician was able to talk to his clients about things that were affecting their physical pain, and once those stresses in their life had been explored and let go of using various hypnotherapy techniques, clients that looked like they were, not going to do well were completely free of the ailment. So you see, I keep going back to the medial and lateral parts, going up into the shoulders and the knees. Checking, at the start of the treatment and then at the end, if there's a difference in flexibility. I'm listening out, of course, for the client to pace my breathing to them. I'm listening to see how their breathing has changed. I'm checking their pulse at the start and at the end, on the top of their feet. Sam Bellier, the foot reader, does some great work on pulse reading, among other things. I'm going into the intercostals there, massaging around the iliac crest at the top of the ankle there. It's like a deep massage. So when we're getting, midway with the treatment, we have a picture of areas of imbalance. I say midway, for instance, when you start to work on the adrenals at the start, they can feel completely different by the end of the treatment. So you kind of want to assess the adrenals for stress. and cortisol levels at the beginning and midway and at the end as much as possible. But when we have a picture of the areas of imbalance, obviously rather than diagnose, we can use the feedback from our client to suggest getting advice on the right exercise that could improve mobility. So you'd outsource to physiotherapists, or if you've got some good ones that you know, or the client can decide to go and do that themselves. And also how the client can stretch out those shoulders. But I would also offer extra work using auricular and facial reflexology with lots of good points to ease that muscular strain. It's a lovely combination. So if this was then combined with some therapy to eliminate the old stresses and give the client simple techniques they can do to manage stress through emotional regulation, then they may just find the equilibrium returns and they can get on with enjoying life again and sleeping better. Either way, this is the time to give clients insight into the mind-body connection and give them some agency over how they feel going forward. So even if you have a client that literally just wants to come in, take the socks off and pass out, they will still be able to notice the difference between their physical feelings at the start of the treatment and their physical feelings at the end, and how that plays out in their thoughts. So maybe you can think about taking a regular itinerary, doing something like the Wheel of Life, reading some new books on the mind-body connection, on thinking about areas for improvement. Here's an interesting one as well. I don't play music in my reflexology room. I've got no pan pipes, no whales. What else? You know, that kind of music that always gets played. And the reason I don't is because my choice in music might actually really annoy my client. I can't stand those panpipe things. So I'd have the bang up immediately I went into a treatment if someone put that on. And I'd more than likely be thinking about a comedy show. Well, I suppose that helps, but it's not conducive to relaxation for me. So what I will say is, if a client really does like music, I'll say, why don't you bring your own so you can listen to something you really like, because it is a form of self-hypnosis that way, because I know it's the choice they've made, but I'm not going to impinge my choice of music on my client. And the main reason I don't do that is because most of our life is in noise. Most of our life is looking at phones. Most of our life is looking at screens, whichever screens they are. And I will do another reflex video on sleep. Because it's fascinating. So when my client comes into the room, it's really nice and quiet, and it's just their own space where they can completely switch off and literally let go. And it can be a bit odd going from noise to nothing. Obviously I love it. I've been meditating since I was a little girl, and I love self-hypnosis, but it takes a bit of getting used to when you're just used to having things on all the time. So I like to leave either no music or choice of music to the client if they want to bring something they want to put on. But ideally I don't want any music, because I want to listen to my client's breathing, pace to it. The forearm technique can be really good when you just want to relax the client after some deep work. So now obviously I'm working on the digestion. Of course, the other thing is that when we've been working on all the muscular tension, we want to flush out all the toxins that we're moving. And that's what I'm doing here. Do adrenal kidney work, and then obviously what I'm doing here is descending colon going into rectum. With some clients, if they have stomach issues, we can direct them to visualize that elimination. For instance, if someone has really bad constipation, we can collaborate with them and using techniques from both NLP and hypnotherapy, we can engage with the client so they can literally trace anything compacted and help move it out of the body. I hope you've enjoyed this video. I'll put underneath the books that I've mentioned. But of course, never stop reading with reflex and hypnotherapy. Just don't stop reading. Look at the classics, look at what's new in reflexology. I belong to the Association of Reflexologists. They're always showing new research, so look at new research, see what's happening in the research field. I'll put some research papers underneath about reflexology and hypnotherapy for chronic pain as well. I think more needs to be done. I offer both a 6-week masterclass, just waking up the reflexes now, as my client was super relaxed. I offer a 6-week masterclass on longevity, including work on sleep, meditation, hypnosis. You get 1-to-1 sessions, but I also offer online hypnotherapy and meditation. Which will include reflex work you can do at home as well. So you get that mind-body connection. Lovely, relaxing solar plexus. Constantly going back to the head. So you've got a couple of minutes left here. I hope I've given you some things to think about. Nice bit of feedback there on the other foot. Did you see that? So, I hope you have a wonderful day, morning, or night, wherever you are. Look after yourselves. As the video finishes, one nice thing you can do for yourself is take 3 comfortable breaths in and out. And as you breathe out each time, imagine breathing out any pressure from the day. Like breathing in new resources and breathing out any old stuff doesn't serve you. Take care of yourselves.